Hello and welcome to Praying Wombs. This is Dr. Suzanne, and I want to tell you about the power of your prayers. Sometimes you pray and you ask yourself if it's really working, or you pray about a situation for years and you don't see a result, and in fact, what you're praying about is getting worse. And you ask yourself, Father, how am I praying? What is happening here? But, the time of God is the best time. That's one. And then two, every time you pray, there is a movement in the spirit. I want to tell you a little brief story because it's only this week that a patient disclosed it to us. This is the story of the patient. We've known him for years. It's an adult, and he has a commercial insurance. Like if you practice medicine in the States, you know about different types of insurance: the commercial insurance, the state insurance, Medicaid, Medicare, and things like that. So back during the COVID pandemic, we had a treatment protocol that really helped our patients stay alive. And I remember this patient came. He was offered a treatment protocol. Remember that there wasn't really a lot of directives about how to treat patients. Practitioners used to tell them to just quarantine, and then if he was getting worse, they could go to the hospital, and usually there they could get intubated and get more care. I remember this patient came and we offered this treatment protocol. We also offered oxygen. Now he's an adult. He is very overweight, and we know it was a huge risk factor when you had COVID because the pneumonia, you could get intubated, you could have more complications. So this patient had obesity, he had asthma and allergies, and I also believe that he has diabetes. He came on a Friday, and we offered him protocol, and because it wasn't anything official, he's a very brainy person, very logical. He said, no, this treatment is not approved, is not official, so I don't really want to take it. Let me just think about it and I see if I get better or not. But he declined our treatment, and we said, it's okay, but a lot of our patients are doing well, especially patients who have borderline oxygen. We even offered him an oxygen concentrator, and he declined. He declined everything, thinking that he was going to be fine. He said, okay, you can't really force patients to do what you want them to do. So it was on a Friday. And over the weekend, because we don't open during the weekend, over the weekend, the patient got worse to the point where he was admitted to the hospital by Sunday because he couldn't breathe. He couldn't do anything. He went to the hospital, and the following week, his wife came to the clinic, and she was coming to get some paperwork to sign for some forms because she told us that he was not going to make it, and the doctors asked her to sign some paperwork. So she came here to get some information because we have some of patients' identifications, some of the forms they signed for their health and all that, and we can pull that from the files. So she was coming to get that, and then she left. And the front desk, our people at the front came to look for me and tell me, oh, Dr. Suzanne, the wife of so-and-so came, and this is what she said. I was like, what do you mean? Well, they say he's deteriorating and they don't think he's going to make it because it's really bad. He's intubated, he's not doing well, he's already lost consciousness, he's in coma, and she was coming here to get some paperwork to get them signed. I said, well, the fact that he came here, we spoke to him, it means he has a covering. Even though he refused to take treatment, I'm going to pray for him. So we have a storage room in the back of the clinic, and I went there and I prayed for like an hour. I mean, I had also my prayer book and my Bible, and I said, Father, no, this is not going to happen. But the type of faith I had, like my faith was through the roof, and I was praying with conviction, and I said, Lord, now go to the hospital, help your child. He's not going to die. He still has little children. I see his children. At the time, his youngest son was like 7 or 8. And after the father got sick and he went to the hospital intubated, the children got COVID too. But this time the mother was wise. She brought the children and she said, Dr. Suzanne, give them the treatment. We're not taking a chance. So the children did well, right? But the father went to the hospital. And I prayed. And after I prayed, you pray until you feel a relief. I felt in my spirit that my prayer was answered. I felt it. And I knew he was not going to die. I just thanked the Lord. After that, it was just praise, worship, thanking the Lord. Father, thank you so much for answering my prayers. Thank you, my Father. Thank you, my Lord. Thank you. And then I left and went to attend to other patients. The patient got off intubation. He got off the coma, was eventually discharged home. And I even went to his house. I think it was around Thanksgiving. I cooked for him and took him the food. And I also prayed for him. And I told him, you know what? We were praying for you. And I knew that you were going to make it. Okay. And that was back in the COVID time. It's been like 3-4 years now. It's only this week, and I've seen him since that time. I see him periodically. I usually don't see adults unless they have allergies or asthma, because that I can see children and adults as an allergy and immunology specialist, but I don't see him all the time. It's only this week that this patient tells us that when he was in the hospital in the coma and intubated, he saw me appear to him dressed in white, and I was praying for him and bringing him back to life. Mamma mia. It's the first time he's saying that, and I'm like, I can't believe this. He never said anything before, and I can totally connect to that time I went to that closet because I didn't want anybody to disturb me. I can lock myself there, nobody will know I'm there, and I can pray, I can scream, I can sing. Nobody is not going to disturb the patients, right? It's the first time, just this week. We are in 2025. Oh my God. That's the first time he tells us that he saw me appear to him in white. I said, okay, we thank God. So your prayers have power. I always say that your prayer can go where you cannot go. Your prayer don't need passport. They don't need visa. They don't need permission from anyone. They don't need anything. You speak, and the wind that is going, you don't see the wind, right? You don't know if it's coming from the north, the east, the west, or the south, or wherever. You pray, and it has an effect. So never, ever diminish the power of prayer. Pray. Pray with intention. Pray with faith. Pray with violence. Pray all manners of prayer, supplication. And remind God, Father, you promised this. Please, please, my Lord. Beg God. Thank God for already answering your prayer. Trust in the Lord. Trust in the Lord with all your heart. Do not lean onto your own understanding. The wife came here to sign, to take paperwork because she had to sign for something, because probably that's what the doctors told her to do. But we reversed the verdict. We did reverse it by the power of prayer. And I'm so thankful to my staff because they already know how I'm wired. And during COVID, I was crazy. I was the craziest person on this earth. Just believing with all my heart that people didn't have to die, right? So I was going all out. And I was living my belief and my faith. I wasn't wearing masks. I was declaring that COVID dies when it comes close to me. So my patients could not die of COVID. No. Why? For what? And I did that because I had a revelation. Because I heard the Lord. I knew and I knew and I knew that there is no way it was going to defeat us. We had to take authority, medically, spiritually, in time, in space, everywhere. We had to declare. So I encourage you, if you're hearing me, don't be afraid. When you face situations, hey, you know what to do. Open your mouth and begin to pray. Even if you are afraid, get that fear out of your body by praying. Pray, declare. Ask the Lord what you want to see. Speak life. Speak life. The power of life and death is on your tongue. Refuse the diagnosis of defeat. Refuse the diagnosis of death. Even if you're praying about something and you don't see results, keep praying. Why? Because it means that you still have a lot of mountains to climb, but you will surely get there. Weeping may endure for a night, but joy is coming in the morning. Don't get discouraged. Even when you see that, oh my God, this situation is so desperate. What you do, detach yourself and give it to the Lord. Pray, have faith, and don't confess what you don't want to see. Confess what you want to see. If something contrary to your expectation is happening, begin to declare. Begin to remind the Lord, Father, you gave me these children. I prayed for them. When they were born, I consecrated them to you. They belong to you. They are pillars in your house. There is no way they are going to sell the devil. Continue to pray. Even if you see that what you're saying is not happening yet, continue to pray. Speak light. Speak peace. Speak. That's it all. All right. Thank you so much for listening. I'll talk to you later. Remember, power in prayer. The 2 P's. Power, prayer. Amen. Amen. Have a wonderful weekend. Bye-bye.